dimensional that could accommodate biochemicals in it. So we could, in the future, put antibiotics, we could put molecules to decrease bleeding, we could put molecules to enhance wound healing, we can put molecules that are related to surgical oncology or whatever, or even fluorescence molecules. So this is a scaffold for intelligent wound healing in the future. Here's the catheter. The catheter delivery system is coming in 200 centimeters, and it can go inside a colonoscope or a gastroscope. And it happens that you may want to do colorectal surgery or deliver a magnet to ligaments and tracts with a colonoscope. So you need to have this length of delivery. It can be used with a magnet through a trocar and deliver it inside the peritoneal cavity or through an enterotomy or inside the skull. It is attached to the end of the magnet and is easily released with one 3 fingers. Here's the connect and the release position. You have laparoscopic position device. These are magnets encased in titanium on a stick that goes through a laparoscopic trocar. Right now we have those from 12 Newton to 27 Newton. And then we are having new ones that are going to come out that goes through a 5mm trocar, because sometimes people want to have smaller incisions. We have magnetic retrieval device. This is a magnet that is at the tip of a catheter going in an endoscope. If you want to retrieve the magnet inside the stomach, pair a magnet that is sitting in the colon that doesn't want to come out because they support contraction of the colon, atonia, then you need to go with either a colonoscope, gastroscope, endoscope, and get the magnet out and reposition them. If you're at surgery, for example, someone has swallowed a magnet, it's in the stomach, and it's not progressing in the intestine, you can go by gastroscopy, retrieve this magnet, attach it to a catheter, and then deliver it by endoscopy at a position of the intestine. You have liver retractors that are made of titanium, so these are non-magnetic instruments. And we have a few companies now that are making laparoscopic non-magnetic instruments. Some of these instruments are made of steel that are demagnetized. Some are made of titanium. Some needles are made of tungsten. So you don't have to now start to think that we need an array of instruments that goes with magnetic surgery that are non-magnetized. You need bulldog clamps when you're delivering a magnet in the small bowel, in the gastric pouch, and you don't want extension of the whole bowel. Use these intestinal bulldog clamps. They are retrievable bulldog clamp at the tip of a laparoscopic plier, and you have several companies that make those. The important one is it has to be flat, intramatic, and not like a vascular. Some people confuse the vascular bulldog clamp with intestinal bulldog clamp. Intestinal bulldog clamp is very flat and intramatic. So we've been using this into this duodenal. I will skip some of the early work in the animal that has proven this compression. We've obtained patents in 2008 to make these compression anastomosis using magnets between the duodenum and the ileum, and also duodenum and colon, for those who think that this is pretty aggressive, and form a company during the pandemic in May 2020 that was called GT Development. And it's with my partner, Thierry Gall, and the senior engineer, Todd Cricket from Minneapolis. So GT means Gagner and Gall. These are the two co-founders of the company, and it's not run too easy. So this is the duodenal, the two magnets. these are looking like the starship in Star Wars, if you want. And but these were not working well because when they were going on the other side, they would make a wedge and not working. So we've abandoned some of these early prototypes and repeated some of the porcine work for these magnets. And you can see in the porcine work, extensive work in big several bundles to find the appropriate size, the appropriate force, so that if it's too strong, you will have a leak at 4 or 5 days. If it's not strong enough, it will stay there for weeks, months, before it can make some anastomosis. So you need for each type of anastomosis to find the right force and shape, otherwise you can have the damage. So not every magnet works for every organ, as you can imagine, with good alignments. Why are we making these magnetic anastomosis? Because they are better. They are better than what we've been doing with sutures and staples. This is coming from work of Michael Larson, pediatric surgeon at the University of California in San Francisco, and he's done this comparison between staples and magnets, and he's been able to demonstrate that the first ratio is higher with magnets than with staples. The Russians have demonstrated higher burst pressure with the magnetic anastomosis in the intestine of the rabbit compared to hand-sewn sutures at any time of this anastomosis. And then finally, the Chinese have demonstrated a faster operation with